Hey, don't get panic. You don't have cancer. If someone say to you might not have cancer, yes, it is Arup Karmakar in front of you to clear some of your doubts. If you have some health issues and you have done some ultrasound, CT scan or whatever, maybe or some doctor has said that you have a cancer, please don't get panic. You have to check for your checklist for the cancer. What to do? What the things you have to look for? First, one is the imaging. You can go for ultrasound or you may have the CT scan to diagnose that it is a cancer or not. In some cases for MRI also. And in some patients, you may not be able to go for the CT scan because of poor renal profile or the your creatinine is high. Then what? You go for a MRI of that area. MRI can give you the answer even without the contrast. That is without injecting the medicine also you can get the diagnosis. First thing. And second thing, on diagnosis for cancer, you can go for tissue diagnosis, which is the confirmatory diagnosis for the cancer. And what is tissue diagnosis? Yes, you have to take out some tissue of that part where is suspecting cancer or the tumor is there, and that tissue taken out by a needle, sent for the laboratory to see what type of tissue is. It is a cancerous tissue or not. And if it is the cancer, then what is the type of cancer? That will give you the answer for the treatment site and the prognosis of your treatment. Because type of the cancer is very important nowadays to treat the cancer. Thirdly, to see the tumor markers also. Tumor marker means there are some specific antigen specific to the tumor, which is increased if the tumor is there. For final diagnosis of the cancer, you need to combine all these things. One is radiological findings, tissue findings in biopsy or FNAC, and the tumor markers. Additionally, you may need to see the body fluid analysis tests also. And all of this combining, you can get the final diagnosis if you have the tumor or the cancerous tumor or you have something else. And now, if you have the diagnosis of cancer of any of the organ of your body, then don't be panic. Now it is the time to check the metastasis. If the cancer cells gone to the other organs from the primary organ, then it is called metastasis. It is to be find out if the metastasis is there or not. Most sensitive way to see the metastasis to the other organs is the whole body PET CT scan screening. Sometimes MRI of the brain, MRI of the soft tissues, like this. Now if you are in a position that if you have a cancer and if you have the cancer, it is a metastatic cancer or non-metastatic cancer, you can now plan for the treatment. If you don't have the metastasis, you can have the good prognosis to the targeting the tumor wherever it is. After confirming from all this checklist, if you have the cancer also, don't be panic and don't take so much of faith or so much of strength on your family, relatives, friends or so-called well-wishers advice. Then you think if you need, you can take the second opinion from a second doctor, or if you want, you can take multiple opinions from the multiple concerned doctors. Then finally you take the decision for the cancers and sure you will get the better result on the treatment. Thank you.